Thank you, Carly. Well, for new parents, the process of giving birth is stressful enough.
Yeah, and no one walks into the hospital thinking that they will have to leave their newborn in the NICU, but for some, that is a reality. And for more on that, we want to welcome in Dr. Jimcia Donato. She's a neonatologist from HCA Midwest Health. And not only that, but you experienced this as well, doctor. Tell us about your experience with your own children.
Well, last year, my husband and I were really excited. We found out we were pregnant, not with one, but two. We were quite shocked. It was a spontaneous twin conception, and we were really excited. The pregnancy went great until it didn't. Right around 19 weeks, my cervix dilated, and my little babies were trying to come into this world several weeks before they'd even be viable. It was terrifying for me, certainly as a soon-to-be mom, and certainly also as a neonatologist, knowing all that I know about micropreemies and the struggles they can have in the NICU. I knew that there would be a long road ahead of me and my family and my girls. I was admitted to the antepartum unit at Overland Park Regional Medical Center, received awesome care, had a cervical cerclage placed that lasted me about 3 weeks, got my baby girls to viability, and they were born just past that threshold at 22 weeks and 4 days, weighing 14 and 15 ounces.
Wow.
Oh, my gosh.
Dr. Donato, what are some of the first things that you say to parents when you tell them that you're going to have to put their child in the NICU? It has to help them that you've lived through this experience.
I found a lot of humbleness in this journey. When I go to meet with a mom who's in my shoes, I am very transparent about my journey. I let them know that, that it was scary, that there were happy moments, but the most that I like to really focus on is that there was a lot of hope. I also like to highlight the care that I received. Micropreemies, their outcome is really heavily dependent on the type of care that a mom receives before they're even born. And then after they made it to this side of the womb, then they land themselves into the expert care of neonatologists who did a really wonderful job. I generally just go over all the things that they can expect, but I'm always sure to let them know that while this may sound like a lot of information, we're going to be here with you every step of the way. We're going to hold your hand. We're going to give your baby the best chance that we can give him or her, and we're going to put our best foot forward every day.
On average, doctor, how much time will a baby spend in the NICU? I know it varies, but is there an average time?
So generally what I like to tell moms is go off of your due date. It's really easy to remember that day. We all get really excited about that day as soon as we find out we're pregnant. Generally, the amount of time that it takes a baby to grow and develop inside of mommy's womb is going to be equivalent, if not longer, to the time that he or she will need to develop outside, especially from a neurological standpoint. For preemies, especially from a breathing and lung standpoint, their lungs have a lot of maturing still left to do, even if they're born at term. So I always ask moms to be realistic and go off of your due date. So if your baby, like my girls, were born at 22 weeks and 4 days, my due date was not until February 10th. So while those little girls made their debut on October 11th, I knew realistically I'd be in for a long haul. My girls actually went home 4 weeks after my due date, about 4 weeks after, on March 8th.
Okay, before we let you go, how old are your girls now and how are they doing?
My girls are 7 months chronologically. They're 3 months corrected now, and they're doing awesome. They're cooing and talking and rolling and eating a ton and smiling. They're fun little babies, and they're thriving, and I'm so grateful for their care and for their outcome.
Oh my gosh, that is the best news at all. Just a personal note, my son spent some time in the NICU after he was born, and it is doctors like you, Dr. Donato, and the nurses and all of those that are so dedicated that work in the NICU that make a parent like me feel thankful that Gus received great care like you provide your patients and that you've got firsthand for your children. So it's just, I can't say enough about the amazing work that you and nurses and everyone in NICUs do, because it is such an important job, you know, to calm parents like me down. You know what I mean? Like, this is a very stressful time for a parent, and you guys do amazing work. And we're thankful that your kids are okay, and thankful for the job that you guys do. So, Dr. Donato,
well, thank you so much.
Yeah,
thank you so much. I'm also grateful to the care that my very own colleagues gave my girls. My fellow neonatologists were taking care of my own baby girls. They did a wonderful job. The nurses were amazing. And I just want to let all the parents know to have hope, be excited. There will be a roller coaster. There will be some great days. There will be some bad days. But this celebratory pink behind me just shows you to have hope and be happy. The days are long, but the years are short.
Oh, my gosh. That's amazing.
Gus just got his braces off, so Nick can speak firsthand to that. Braces in your future, too, I'm sure.
Yeah.
Thank you so much. Have a wonderful day.
Yeah. Have a great weekend, Dr. Donato.
You guys too. Thank you.
From HCA Midwest. Thank you.